there is an epidemic which is coming for the lifestyle-related diseases. As you can see in the year 2016, significant chunk of the diseases from lifestyle-related diabetic, coronary artery disease, obesity have started emerging also. So we have a mix of both. There are paradoxes in India, from starting from slums to a very, very posh high-rise buildings, and same is true for the provision of the healthcare services. As you can see in this particular slide, there are two extreme examples of a primary healthcare center and posh tertiary healthcare center in a private sector in a metro city. Also, there is a paradox that we cater a lot of medical tourists, and also for the treatment of our own population, many patients, because of the non-affordability, they fall below the poverty line after getting a high-cost treatment from the Indian hospitals. So this is again a big paradox which you should always remember, the figure of 70. That the 70% of the spending for the Indian healthcare comes from the out of the pocket, from the pocket of the patient. And if you can see the bottom of the slide, if you can see the bottom of the slide, 70% of our population live in a rural area, whereas the services or the infrastructure or the medical services which are provided are predominantly focused in the urban centers. So there's a significant mismatch in fact, which is because India lives in the population of India predominantly lives in a rural area, and the technology and the infrastructure is more in the urban area. If you see here in this slide, also India is totally and highly import dependent. 70% of the high-tech, medtech devices we are importing. As if you see, only a few devices which are in the field of disposables and small consumables, syringes, needles, are manufactured in India, and we are not dependent on much on the import of these devices. But if you see the implants, many in vitro diagnostic reagents, and high-cost electronic and surgical equipments are still imported, and to the tune of around 60 to 70%. The penetration of medtech devices in India, despite of having such a populous country, such a large population, is very minimal. That is only 3% of the per capita consumption of medical devices. This is a figure in 2016, as compared to the other countries which have may even have a very smaller population, but you can see that they have a significant penetration of the medtech devices. And there's a reason for that. And if you see that very well iterated in the right side of my